Let's discuss diagnosis according to Zangfu organ patterns, in particular, lung imbalances. In this diagnostic model, patterns are differentiated in relation to changes in the functioning of the Zangfu organs. What has elicited these changes can both be external influences such as climate, diet, emotions, and lifestyle, as well as internally generated imbalances such as heat, dampness, young deficiency, and others that are affecting the functioning of the organ. When the Zangfu organ is negatively affected, it will manifest symptoms and signs that relate to a disturbance of its physiology, as well as signs and symptoms that relate to the tissues, sense organs, emotions, vital substances, etc., that are influenced by this organ. The diagnosis will be based both on changes in the organ's physiological processes and changes that are manifesting on the exterior of the body, such as changes in the skin color, sound of the voice, pulse, tongue, etc. The Zangfu diagnoses are often Now let's go to lung imbalances. The lung has several functions, the most important being that it controls qi and respiration. Along with the kidneys and spleen, the lung is responsible for the production of qi in the body. Zong qi, which is created by the lung, is the foundation of zhen qi. This means that all the organs are dependent on the lung, as well as the kidneys and the spleen. If the lung qi is weak, it will affect all other organs of the body. The lung is the only Zang organ that is in direct contact with the world outside of the body. The lung is in contact with environment through the upper respiratory tract and through its related tissue, namely the skin. Wei qi, which is spread by the lung, circulates under the skin and is the first aspect of qi that is affected when there are invasions of exogenous qi. This makes the lung vulnerable to exogenous influences. It is for this reason that the lung is called the sensitive or the delicate organ. The etiology of lung imbalances. As described earlier, the lung is in direct contact with the environment through the respiratory tract, the skin, and the Wei qi. This means that exogenous qi can be a very important etiological factor in lung imbalances. Wind is the spearhead that can pierce through the Wei qi and lead other forms of exogenous qi into the body. Qi will initially be combated by, but will also block Wei qi. Because it is the lung that spreads Wei qi, the blockage of Wei qi will have a stagnating effect on lung qi. If qi is not expelled, it can penetrate deeper and affect the lung more directly. Wind, cold, damp, and heat are the forms of exogenous qi that we most often meet in the clinic in Western Europe, Northwestern Europe. It is important to remember that the lung is also very vulnerable to dryness because it is a Zang organ that is in direct contact with the air. If the air is dry, it can desiccate the lung and injure lung yin. Although this has not traditionally been a problem in a maritime climate, it is something that has become more relevant over the years due to interior environment of modern buildings, especially buildings made of concrete. Furthermore, it may be a problem in very cold regions where the air can be very dry in the winter. Damp and phlegm in the lung can arise when exogenous qi condenses and congeals in the lungs so that it transforms into phlegm. Chronic phlegm in the lung, though it is often the result of an imbalance of the spleen. There is a Chinese medicine saying, phlegm accumulates in the lung, but it is created in the spleen. This is because the spleen sends good qi up to the upper jiao, where the lung creates Zong qi. If there is spleen qi deficiency, or if cold or damp and phlegm creating foods are excessively consumed, the damp and phlegm that are generated will ascend together with the pure qi up to the lung from the middle jiao. This has great importance in the relation to the treatment strategy when treating lung phlegm imbalances. Food and drinks that create heat in an organ can also affect the lung due to its physical position in the body. The lung is a canopy that arches across the other organs in the top of the body. If these organs are affected by heat, or if there is heat generated by one of these organs, the heat can rise up to the lung due to the yang nature of heat. The spicy flavor is very dynamic and moves from the center to the periphery. The spicy flavor is therefore used, amongst other things, to open the exterior. That is, the spicy flavor can induce a sweat. This is fine when Wei Qi is blocked by exogenous Qi, but if the spicy flavor is excessively consumed, it will weaken lung Qi and lung Yin. Lack of nourishment, such as eating too little or eating food that is of poor quality, can lead to a generalized Qi deficiency condition that is thereby also lung Qi deficiency. The lung inhales air from the environment. The air is known as that Qi or great Qi in English. This means that the quality of the air that is inhaled is of great importance for the lung, as lung Qi is dependent on whether the air is fresh and pure. This is the reason that people get tired and sleepy in rooms where the air is heavy. Air pollution can also create imbalances in the lung. This can be seen in allergic reactions as well as in chronic ailments. Although air pollution does not fall within the traditional Chinese categories of exogenous qi, it can still be defined in relation to these imbalanced categories by analyzing how it affects the body. If an allergen or pollutant creates symptoms and signs, such as those seen in wind heat, for example, this allergen or pollutant will be defined as having a warm nature and will be treated accordingly. In this context, it is appropriate to mention tobacco smoke. This is a form of pollution that many patients will have been exposed to, both voluntarily and involuntarily. Tobacco smoke is warming and drying in its energy. This means that it is likely to injure lung yin, create heat in the lung, and boil fluids in the lungs so that they congeal into phlegm. Furthermore, the combination of heat and phlegm can lead to the creation of blood stagnation and toxic fire in the lung. Blood stagnation, toxic fire, and phlegm in the lung are three of the most important precursors to lung cancer. The lung descends and spreads qi and zhen throughout the body. When there is an inhalation, the chest opens and qi is sent downwards and outwards. Poor posture can impede this function. If a person sits or stands in a stooped way with a sunken chest, this will burden the lung because it has to use more force to spread qi out from the chest. The lung is emotionally affected by sorrow, melancholy, and worry. These emotions encompass many other and more nuanced emotions, but common to many of these is that they debilitate and bind lung qi. Therefore, emotions such as powerful, prolonged, or unprocessed grief, worry, or speculation can weaken lung qi and stagnate qi in the chest. The lung cooperates closely with several of the other Zang organs, as well as its partner organ, the large intestine. There are therefore often combined patterns when there is chronic lung imbalance. The lung and liver are both involved in spreading qi, and thereby also blood through the body. Disturbances of these organs, qi, can therefore affect one and the other. Furthermore, liver fire can invade the lung. The heart and the lung have a very close relationship in terms of their physical location, and especially in relation to zhong qi and moving blood through the channels and vessels. The kidneys, urinary bladder, and lung cooperate in relation to fluid physiology, and lung yin is nourished and moistened by kidney yin. Furthermore, lung qi is grasped by kidney yang. The spleen, stomach, and lung are closely involved in the transformation and transportation of qi and ji. Finally, the lung and the large intestine's relationship is seen not only in that lung qi deficiency can lead to constipation, but also in that constipation can disrupt the lungs' sinking function, leading to difficulty in breathing. Thank you for your attention.